We do have a special guest with us today, and I would like to bring our Vice President, Carla McGill, up to introduce him. And you can continue enjoying your breakfast, but I'm going to bring Carla up now. Thank you.
Good morning. It is my great honor to introduce our guest speaker today, Dr. Washington C. Hill. Dr. Hill is past Chief of Staff, Medical Director, Labor, and past Director of Maternal Fetal Medicine at Sarasota Memorial Hospital. He's also a clinical professor, Department of Obstetrics and Gynecology at the University of South Florida in Tampa. Dr. Hill is board certified in obstetrics and gynecology and fetal and maternal medicine, and served as an examiner for the American Board of Obstetrics and Gynecology. He's a graduate of Temple University School of Medicine in Philadelphia. He completed his residency in obstetrics and gynecology at William Beaumont Army Medical Center in El Paso, Texas, and a fellowship in maternal and fetal medicine at the University of California, San Francisco. Dr. Hill is known throughout the nation for his expertise in maternal and fetal medicine and high-risk pregnancy. And I'm sure very many of you in the room are probably familiar with Dr. Hill. He joined Sarasota Memorial Hospital staff in 1992, where he developed the now respected maternal fetal medicine program. He's a member of a number of medical organizations and has received honors for his work in the community, and he has served on the board of the National Perinatal Association and the Society for Maternal and Fetal Medicine. Black Enterprise magazine recently named Dr. Hill as one of the top 10 black physicians in the country. In his little bio sketch, he put in quotes, in his spare time, he likes to travel, especially to Africa on medical missions, and is happy to recruit to go also. It's my great honor to introduce Dr. Washington Hill. The title of his presentation is Your Prescription for a Healthy Pregnancy.
Thank you very much. Thank you very much. First, I want to introduce my wife. She's not a morning person, okay? She's an NICU nurse, but she's not a morning person. So wave your hand, Pauline. That's about as much as you're going to get out of Pauline until noon. It's always a pleasure to talk to groups like yours, and many of you I know, I've worked with over the 20 years that I've been in this community. And I was asked to just say a few words about what we're trying to do in regards to healthy pregnancy. And what I had come up with for our hospital, and you're welcome to use this, at all of your tables there's a little prescription pad. Grab it and pass it around. And we're going to go over the prescription pad. But before we do that, I saw this, get healthy before you get pregnant. And I've been in this community 20 years. And what we have tried to do, and I think some of you would agree with me, is to try to help women, girls, teenagers, partners have a healthy pregnancy. Is that not right? Can I get an amen? Amen. And we've done it, I hope, in a way that you will be able to, as I leave the community, I'll tell you that at the end, use that information, because that's what it's all about, is trying to have healthier pregnancies for those who are pregnant. And one of the, yesterday, for example, I was up at the Pregnancy Associated Mortality Review Committee, this time flying around Tallahassee because it was fog for an hour, and finally landing in Tallahassee. and reviewing maternal mortality cases. We do it quarterly. Any one of you who wants to go, all you have to do is say you want to go. And you can go up to the Pregnancy Associated Mortality Review Committee and review the cases with us and provide input. I guess there are two requirements. One, you pay your own way, and two, everything discussed in the room is confidential. But when we talk about having a healthy pregnancy, and when I get back to my office, I'll try to send a note to our docs and to our nurses. We can't tell you the cases, but we can tell you the messages. A couple of messages that came up yesterday. The combination of OxyContin, methadone, and cocaine can be deadly. Does that make sense? And in fact, the meeting before this, the combination was Xanax and OxyContin and methadone. Can be deadly. And I had a patient just the other day at the hospital, and I said to her in a nice way, "You sure got yourself in a mess." And she was using methadone from not too far from here, right? And OxyContin, and had used cocaine and was in preterm labor. So that's a message that you need to share with your patients, and you know it. Another message: you can't send a patient home if they don't have a home. You got that? Did everybody hear that? Did everybody understand it? So as we all know, you can't discharge a patient home if they don't have a home. Another message that came up yesterday. Patients who say, and I know the folks from Manatee Memorial Hospital deal with this every day, the patient who says, "I need to go home for child care," is really not being non-compliant. Agreed? She wants to go home because she needs to take care of her children. Debbie, have you ever heard that before? A very good friend of mine, Michael Lindsay, was visiting the group yesterday from Emory, and I turned to Mike and said, "Have you ever heard that before?" He said, "Every day." Every day. So we have to try and find ways to take care of those patients' children so that they can stay in the hospital. The patient died. Blood pressure, she was severe preeclamptic, 180 over whatever, and she said, "I'm sorry, the way things are going on at home are not good, and I have to go home." She went home, and she passed away. So those are some of the messages that we hear from, and what we try to do is to cure those problems, and we can't cure them all. And I know you here in Manatee County and we in Sarasota County, and actually the state of Florida, we're on a committee working with the state of Florida, are trying to solve the problem of substance abuse. It's a big problem. We know it's a big problem. And we're making headways, as we tried with the city commissioners, the city or county? County commissioners, yeah, Manatee County, with the county commissioners, and we will continue to do that not only here, but in Sarasota. So there's little gains. I mean, we've made little gains, but these little gains together are big gains. You all should all pick up this brochure. It says, "Get healthy before you get pregnant," and then I'll go over the prescription. One of the things that we continue to say at PAMR is that pregnancy should be planned. As you know, 50% of pregnancies in this country are unplanned. That's horrible. 50% of pregnancies occur by an accident. And we really need to work hard on doing that. And they occur by accident in people who should not be pregnant in the first place. We had a patient who passed away. Her BMI was 49. As you know, the BMI, if you're over 30, you're overweight. Now, I'm not going to ask anybody here to raise their hand and tell me your BMI, but my BMI is 29.999. I hope. So here's a patient whose BMI was 49. She had hypertension. She was doing drugs, et cetera, et cetera, et cetera, and she was pregnant. And she'd been told, oh, I'm sorry, she had a coronary artery stent in place. She'd been told not to get pregnant. A nephrology friend of mine said, Wash, this is a patient who had chronic renal disease. I told her not to get pregnant. And I said, that usually does not work. I see some older ladies here in the audience, not older than me. Hope and prayer are good for certain things, right? But it's a very poor method of contraception. So that we need to plan pregnancies, and those patients with chronic diseases should not be pregnant. Obesity. There's a theme in the patients who we see that die, and it is obesity. But we have to be sensitive to that. You know, when you're poor and you live in a neighborhood where they don't have anything except Kentucky Fried Chicken or Popeyes or whatever, and you don't have much money, then sometimes you have to eat what you can afford, correct? And what you can afford may not be very healthy, and that's where Healthy Start comes in. And we tell patients that you need to and when I dictate a note, and some of you have seen them, this patient's BMI is 49, I say, this patient may be able to benefit from a Healthy Start. That's a nice way of saying, please get her to Healthy Start. But some of these patients, unfortunately, can't change it, and some of them don't feel there's anything wrong. I'm sure that some of you have talked to the patients, and I have said to them, how do you think your health is? And they say, fine. What's your problem? I had a patient actually tell me that. I said, no, I don't have a problem. But we need to find a way to help them and to be sensitive to their problem, which is obesity. Because we now know that obesity begets obesity. It's a circle. And the mother is obese. The baby is programmed to be obese. What do I mean by programming? It's probably genetic, but there's some programming, whether it's hormonal. We used to think that my fat was just fat, but now we know it's an endocrine organ, and that it produces hormones which then produce the same problems in the fetus, and then in the neonate, and then some of it is environmental. Correct? You go home, you're in an environment where food is the cure. And then that circle continues, and if it's a female, you're going to see her back in your office and in your clinic. So this is a very good thing, and please grab it. Now, I gave this presentation somewhere recently, and this is a little prescription pad. And what I did was I actually asked some nurses and physicians, what are the important things that our patients need to know? And they're on this little pad. Avoid substance use, prescription or not, before pregnancy and during pregnancy. I don't think I need to mention that again. We have a problem. We need to be working on curing the problem. We are applying, and it's going to go in today, a grant from the March of Dimes to put on a conference. I hope we get it, because I know we can do it well. And it'll be in November. And what we need to do is to bring together all the players and try to see what we can do for substance abuse and pregnancy. PAR does an okay job. Right, ladies? Sometimes they do a good job, but PAR is not the answer. The answer, when I ask the patient, where are you getting your methadone, the correct answer is what? PAR. I've heard all kinds of things. Let's not go there. I don't want to talk about it. My sister. I don't want to tell you. So the correct answer is PAR. And we should be, patients who need methadone, and there are some who need methadone, should be getting it from PAR. We need to work with these patients. because there, by the grace of God, go us. And sometimes it's not easy, is it, ladies? It's not easy, but we have to work with them and help them as much as we can. We had one the other day. The one I told you was on methadone, OxyContin, and cocaine, and we tried to discharge her home, and she said, okay. And then when it came time to go home, she finally said, I don't have one. So we have to work with them. Maintain appropriate weight gain and exercise. Heidi Godman, who used to work for Channel 40, and I did a whole bunch of shows, and one day I said, we need to do something about obesity and pregnancy. And Heidi said, and I remember like it was yesterday, Wash, what else do we need to tell them besides eat less and exercise more? Right? That's what we all need to do. We all can find excuses. I'm very good at excuses. It could rain today. I could be halfway around the block and it start raining. Then what am I supposed to do? Get wet? Very good friend of mine, he's the best man at my wedding. Just kidding, sometimes I say, you're the one. And he said, I said, I can't walk because my wife can't walk with me because she had some surgery. And John said, you don't know the way home? So you have to be able to and walk and exercise. And we encourage our patients to do that. And they need to do that before they get pregnant. Use the seat belt. At least once a year, one of our patients decides she's not going to use a seat belt. It happened here in Bradenton about 3 years ago because I wrote an editorial about it. And it happened in Sarasota, and I wrote an editorial about it. I don't think it's happened in the last 12 months. But when we review the pregnancy-associated mortality deaths, there's always one in the state of Florida where someone was not wearing a seatbelt. Our pregnant women, when you see them at Healthy Start, when you see them at WIC, when you see them in labor and delivery, wherever, you need to remind them that they should wear their seatbelt. Maintain control of chronic illnesses, hypertension, diabetes. I had a patient today, I think she's from Manatee County, I'm pretty sure she is, because she was on our antepartum unit, and she has diabetes. And I said to her, it's so important to get your diabetes under control before pregnancy. Everybody know why that is? The higher your A1C is an indication of how well your control of your diabetes is, the greater the risk of fetal abnormalities and the pregnancy is not going to do well. And the normal A1C is 6.5. That's the goal, 6.5. And she was thrilled that her A1C was 7. It actually was 6.7. And she said, I said, well, that's getting close to 6.5. I'll give you some stars for that. She said, Dr. Hill, when I started my pregnancy, it was 10. So she had done really well, hadn't she? Because as her control gets better, the A1C goes down, and 6.5. Any of you in the room who have diabetes know that that's our goal. So we got to get control over that. Attend prenatal and postpartum visits. One of the things, and I share this with you and the folks from Manatee, that we've learned with the Pregnancy-Associated Mortality Review is that when patients have a chronic illness or have had a complication in labor and delivery or postpartum, they should not be given a prescription to come back in 6 weeks because they may come back dead. And we now, I don't know where 6 weeks came from. I guess I was taught 6 weeks by somebody. I guess by 6 weeks she should have had a period, and then we'll see her after that period, and we'll see her at 6 weeks. So to be very honest, I guess that's where it came from. But now we know, and you're going to see more and more about this, we're going to change it, and that is that patients who have any kind of problem, when we now send patients home from our hospital or you send them home from Manatee, you got to tell patients, we need to see you back in 2 weeks, particularly if they're having high blood pressure or diabetes or whatever. Attend childbirth education classes. Any childbirth educators in the house? There's always a few. That's very important. Patients who know what their problems are will do better than those who don't know. Everybody got it? So if you have a problem of diabetes or preterm labor or whatever, if you know about it before pregnancy, if you know about it during pregnancy, then you will do better. So childbirth education classes are good. I always tell patients there's no such thing as Braxton Hicks contractions. We'll get to that in a minute. Attend breastfeeding classes. We need to be able to do better with that. Unfortunately, in the African American community, for whatever reason, and I just got an email that one of the drug companies is going to work with the National Medical Association about increasing breastfeeding in African Americans, and that's great. But we need to encourage our patients to breastfeed. After all, that's what they're for, right? So we need to encourage our patients, and I know Manatee does a very good job of trying to encourage our patients to breastfeed. Stay informed and involved in your care. I always like a patient who sits there and asks questions versus one who is sitting there reading the Time magazine, and I usually grab the Time magazine and close it up and say, could you please listen? Or they're playing with their iPod, iPhone, BlackBerry, telephone, or whatever. I'll tell you a story. I walked into a room not long ago, and the ultrasonographer said, Dr. Hill, you need to come in and see this fetus. There was a problem. And as I walked in the room, the patient and her partner and their mother were on their equipment texting the sex of the baby. And I said to them nicely, could you all put those things down a minute so I can tell you what the problems are with the fetus? So we walked them through it, and afterwards I said, now do you understand why I didn't want you to be texting? And they said, yes, I now need to text somebody and tell them something. Oh. Obtain the recommended immunizations, and that's important before pregnancy. I just got mine because we're going to be going to Africa in a month. And my arms are sore. Pauline's arms are sore, and she's got the post-immunization crud. But the bottom line is our patients who are pregnant or before pregnancy should get their immunizations. There's nothing wrong with the patient who's pregnant getting her flu vaccine. I don't know how many times I'm asked that. Flu vaccine is safe, and they should be getting that when they're pregnant and before pregnancy. Continue safe sex practices. During pregnancy, understand that 39 weeks is 39 weeks. I saw your 39-week button. The March of Dimes has a whole bunch more. For those of you who don't understand what that means, is that the March of Dimes has shown, and not only the March of Dimes, but colleagues like Steve Clark and others in this country and ourselves, have shown that babies that are induced at 39 weeks, if you need to induce them at all in the first place, do better than babies that are induced at 38 weeks or 37 weeks because Dr. Smith is going out of town. And therefore, many of us wear a button that says 39 weeks plus means 39 weeks. And that's very important for our patients. And the message is getting out. It's not out as much as we would like it to be, but the message is certainly getting out that, first of all, maybe you don't need to be induced in the first place. And that was one of the patients yesterday that we reviewed. Why was this patient induced in the first place? And then if you are going to be induced, not before 39 weeks. A vaginal delivery is still best. Duh. But believe it, some patients request a C-section. About 10 years ago, or even further back, and 20 years ago, actually, Debbie, there was one of the first patients in this community happened to be a nurse who came up to me at the Manatee Memorial Hospital and said, Dr. Hill, I want to have a primary elective cesarean delivery. And now, if a patient wants that, she can have it. In the old days, she could not. But now, if she wants it, she can have it. I try to encourage patients to look at the risk and the benefits and still a vaginal delivery is better than a cesarean delivery. And then learn the warning signs of complications in pregnancy. We try to get that message out not only during pregnancy, but before pregnancy and certainly after pregnancy to our ER docs. When we look at patients who come back in critically ill postpartum, some of them come to your emergency room. So I know that many of you have worked out arrangements with the emergency room so that those patients will be assessed by somebody from labor and delivery. So just recognize that complications can occur after pregnancy and the patient show up first in the emergency room. 2 more things and then we'll be done. Our patients should be counting fetal movement. And there's about 10 different definitions, but I tell patients, and our community should be telling patients, you should be having 4 fetal movements within an hour after you eat. Most of our patients eat at least 3 times a day, right? So 4 fetal movements within an hour after you eat. So those of you working with Healthy Start, encourage your patients to count fetal movements. It's very sad when we have a patient that comes in, and today is Monday, and she says, I haven't felt my baby move since Saturday, but I thought I'd wait until I came in for my appointment on Monday. And you find that she has an intrauterine fetal demise at term. Very sad. So encourage patients to count fetal movement. There should be at least 4 fetal movements within an hour after a meal. And then the same thing with contractions. If a patient has more than 4 contractions in an hour for 2 hours in a row, what should they do? I ask patients that every day, and I'm sure I'll be doing it today. And one patient said yesterday, yesterday I was in Tallahassee, so the day before, call 911. I said, you never were told that. And you're going to call 911 because you have had more than 4 contractions in an hour for 2 hours in a row? So I say, here are the options. A, call 911. 2, call your husband. 3, call labor and delivery. 4, call your doctor. 5, drag your butt into labor and delivery, which is the correct answer, or a couple of them, okay? But not call 911. I don't think they would like that. And the last thing in here says choose Sarasota Memorial, but that's not the point. The point is to choose a hospital. I still believe, and I've written about it, and you know that vaginal births after cesarean delivery should not be at home. Think about it. Doesn't that make sense? So if you want a VBAC, my job and your job is to find doctors and hospitals where you can have a VBAC. Some hospitals, not too far from here, don't want you to have a VBAC. So you're going to have to find a hospital or a doctor who will allow you to have a VBAC. Manatee does, and Sarasota does. So that's important. The second is that even if you have a healthy pregnancy, unfortunately, things can go wrong sometime. Correct? If they go wrong in labor and delivery at Manatee, you are doing far better than they go wrong at a birthing center or at your house. So I encourage patients before they're pregnant to seek out a good provider. It may be Manatee Rural Health, it may be health department, maybe a physician, it may be a clinic, but they need to seek out a good provider and then deliver at a hospital. I think that covers all the things that you need to know and some things that we've learned over the years. I certainly hope that my time in this community has helped produce some healthy babies. Next year, we're going to probably hang it up and do some work with the Clinton Foundation with healthy motherhood in Africa. So it's been a pleasure. Thank you very much.
Well, this award is for someone you just heard speaking for about the last 25 minutes. And I don't know what else I could say than what he's already said. And I think he's really contributed tremendously in the last 20 years to our communities. And he's got a vision to go forward in a year from now to work with even more underserved folks in Africa. And I couldn't think of a more honorable thing to do. Dr. Hill?
And thank you, Dr. Hill. Dr. Hill has been a part of our family, and my daughter that I shared with him will be 6 in August. And our family just thanks Dr. Hill and what he does for us every day to bring healthy babies and to get those babies here and home and healthy. So thank you for what you do every day. At this time, I'm going to bring Marion Stewart and Donna Valenga up for our nominating committee. They're going to present our new board of directors for the next year.
Good morning. It's my pleasure to go ahead and present the slate of nominees for election to the Board of Directors for 2012 to 14 term, along with Donna Valenga. For a 2-year term, Patty Benson, infant advocate. Patty Benson has supported Healthy Start Manatee for the past 14 years. Every year at Christmas time, Patty delivers baby items on behalf of the Democratic Women's Club. She has also conducted consumer surveys at local providers' offices for our service delivery plan. Patty is a retired teacher and very involved in the community with a number of organizations, including the Manatee Association of University Women. For re-election for a 2-year term, we have Anjal Kushan, a consumer. Anjal is the mother of 4 children. She has served 2 terms on the board of directors and has supported several outreach projects. Her insight and input is valuable in designing Healthy Start services to meet the needs of moms and babies in Manatee County. C.J. Zaya, with Zaya and Gallagher, PA. Mr. Zaya has served 2 terms on the Healthy Start Coalition Board and has been a longtime supporter of Healthy Start. He is an attorney with Zaya and Gallagher, a well-known community leader, and very involved with several local organizations, including the Palmetto Youth Center. Christine Harrison, RN, maternal child advocate. Ms. Harrison is a registered nurse and longtime resident of Manatee County with great knowledge of the community. She has been a pediatric nurse for 20 years and has keen interest in children's health. She is a great addition to the current board of directors. Donna?
We'd also like to nominate Jackie Kelsey. Mrs. Kelsey is our past board president. She's a retired ARNP OB nurse. She has been instrumental in the development and implementation of our Project Moses and the Safe Sleeping campaign. She volunteers on our weekly support group for mothers, and she is very loved by the women she serves. Ramona Lewis, she's an infant advocate. Mrs. Lewis is the chair of the Southeast Residents Association. She has served on the Healthy Start Board of Directors in previous years. Her knowledge of the community's needs has been very valuable to the design and implementation of our previous action plans. Carla McGill, infant advocate. Dr. McGill is the president of Healthy Science Communication. She serves as vice president of our Healthy Start Board. She was instrumental in the development of the Coalition's 2005-2010 Service Delivery Plan update and in shaping the direction of our innovative programs. She is an officer of her College Alumni Association and is committed to the well-being of children and families. Beth Trent, consumer infant advocate. Mrs. Trent has been involved with Healthy Start for several years. She's currently our board president. She has served on health problems analysis and action plans update projects. She conducted the Kids Nutrition Corner at one of our Mother's Day events. She has great knowledge of our community, and she is a graduate of Leadership Manatee. And Mary Willis, maternal child advocate. Mrs. Willis is a certified public accountant. She brings a wealth of experience as a mother and grandmother of several children. She is involved with local organizations that support women's health, and she is an advocate for maternal child health. She has served as board treasurer.
Thank you, ladies. At this time, I believe we have to motion to accept the board of nominees. Thank you, CJ. A second? Second. Thank you. All in favor? Aye. Any opposed? Thank you. And now we have Fred Leonard. He'd like to recognize some of our community members. So come on back up, Fred.
This is always the most fun part of the show, is to recognize partners. And before I move on to some additional awards, I want to thank Beth Trent for recognizing some folks in the audience, but I see a few more faces that I'd like to recognize. We have a couple former board members that are here today, and why don't you go ahead and stand when I call your name. This person is, in fact, all these people I'm going to talk about played a major role in bringing us to where we are today. And we have a past president with us, Lorraine Van Lee Brown. If you want to stand a moment. And another member of our former executive committee, used to be a treasurer of our board, Gerardo Ramirez. And another magnificent contributor to our community, now Dr. Valerie Taylor. And I also want to recognize Charles Clapsaddle and his staff that are here with METV today to video this presentation. And I see that our nurses have returned to Manatee Memorial. I was going to say to recognize them one more time, but they've had to go back and be involved with, do exactly what Dr. Hill was talking about with babies. Right now, I would like to invite Donna Vellinga back up. She is going to recognize our next award recognition.
This one means a lot to me. I am presenting this to Still Point House of Prayer. About 8 years ago, Healthy Start started to help the community by kind of having a giving closet. And soon we discovered that we ran out of space. So Sister Nora, I'm trying to make sure I don't interact them. Sister Nora and her board made a decision to partnership with Healthy Start. And over the years, we've had one of our young ladies, Monica, would go once a week to help with literature and information. And we could not do this vital community outreach without the help of Still Point House of Prayer. So I get to invite Sister Noella, who I saw the other day, and Jeff and Sue Bevelo, if you would please come on up. Don't give me that look. Come on up. We love it. We want to give you this plaque. You have to understand that Healthy Start wants to help the community, but we can't do it alone. We're not an island, and we need your help, and we are so appreciative. So they're going to take our picture, so let's do this nice. Here we go. Okay. I'll give this to you. And welcome to Manatee County, Sister Noella. We good?
All right.
Thank you so much.
Still Point would not be what it is if it wasn't for the vision of Sister Nora, but it also wouldn't be what it is today without men and women like Jeff and Sue Belvo, because the volunteer staff at Still Point makes the ministry what it is today. So God bless all of you.
Thank you. Thank you so much. Very nice. Thank you.
Next up, I'd like to invite Marion Stewart. Marion is currently our treasurer of the board, and she's going to make the next presentation.
Hello again. This year, we are pleased to recognize the work of one of our providers who goes beyond her professional duties. Her dedication, commitment, and passion to educate, support, and encourage mothers to breastfeed their babies has been acknowledged not only by our OBGYN and pediatric partners, but by the mothers she supports. I would like to invite Ellen Drews, our lactation consultant, to accept this award on behalf of Healthy Start Manatees, Moms and Babies. Ellen?
Thank you. Thank you. And thank you to everyone, especially at Healthy Start, for giving me this opportunity to spend this quality time with mothers and infants and do something I love. Every day I stop and I think to myself, I love the work I do, and I've never done anything besides raise my own children that brings me as much joy as serving these mothers and babies. So thank you very much.
Okay. At this time, bring up Christine Harrison, member of our board of directors, who's going to present the next award.
Good morning. It's an honor for me to be here, and what I find so inspiring is the number of people that work full-time, that are out there doing so many things, taking care of children, and still find the time to volunteer for Healthy Start. I think it's wonderful, and I'm privileged to be part of that group. Today, I want to talk to you about the number of substance-exposed newborns that are experiencing withdrawal in Manatee County, and that number rose from 2 in 2007 to 27 in 2010, a 1,250% increase according to DCF. The cost of these babies is estimated to be approximately $1.4 million over a lifetime of the extra services they will require. Recent Department of Health and Human Services, those figures show that the highest rate, 36% of Manatee County admissions of pregnant women for treatment is for opiate or other synthetic drug abuse. In 2011, the Florida Alcohol and Drug Abuse Association reported that prescription drug abuse was the primary reason for the need to shelter children in Manatee County. It accounted for over 50% of the number of children that were removed from their homes. And the cost of the child welfare system, $10,000 per year per child for a total of almost $2.7 million annually, is a huge burden. The Manatee County Substance Abuse Coalition has taken the leadership to educate the community, to bring community partnership and support, to advocate for policy and legislation addressing the problems. Healthy Start Manatee is a proud member of the Substance Abuse Coalition and is honored to present an award to recognize the tireless and effective work to ensure the well-being of moms and babies in Manatee County. I would like to invite Sharon Kramer, Executive Director, and Rita Chamberlain, Coordinator of the Manatee County Substance Abuse Coalition, to accept this award.
Thank you. What you see in front of you is a coalition. You're all here for focusing on a goal, and we all appreciate your support. We're here for the babies, and so are you. Thank you for all that you do.
Okay. Now I'd like to invite board member C.J. Zaya to come up, and he's going to make the next very special award.
Good morning. It's an honor to be here with such incredible people. It is my honor to present a Community Health Worker Award. I think it should be called the Health Educator Award. I've been honored to be participating with a group called Unidos Now, which works for the Hispanic community, and there are a lot of Latinos in our community. And this award recipient is dedicated and committed and has a spirit of service like no other. Somebody that can communicate with this segment of the community. She's an awesome, loving, hardworking person that knows how to reach out and communicate exactly what the doctor had mentioned. It educates and inspires our community. Ladies and gentlemen, it's my honor to introduce to you Marta Ramirez, our recipient of this award.
I want to say thank you to God for giving me this job that I love. I love to serve my community, families. Thank you to Healthy Start, Fred, Luz, for the support, and all of you. And also for my husband, who is the one who paid the consequences. Thank you.
I know this next recipient of our next award was unable to be here today, but I'd like to have Board Member Mona Lewis come up and introduce the award so you're aware of the major contribution that this recipient has made in Manatee County.
The award presentation that I'm going to be representing this morning will be for Christine and Steve White, the White Family Foundation. Over the past 5 years, Healthy Start of Manatee County has been blessed by the love and generosity of the White family. Every year, they arrive before Christmas with their big truck and their helpers, unloading thousands of gifts that benefits moms and babies. It is because of their generosity that we are able to offer breastfeeding pumps, strollers, car seats, diapers, baby bags, towels, and infant clothing, crib sheets, and age-appropriate toys to stimulate the little ones' proper development. The family we serve know of their love and generosity, but we wanted the community to know that we do recognize their support and commitment to Healthy Start, Manatee moms and babies. Please help me to, well, the White family is not here, but we would like to present the award to Christine and Steve White to accept this award.
We've arrived at almost the end of the list of the awards, but we have one more very special award. I'd like to invite Donna Valenga and Marion Stewart to come back up on the stage and make the next presentation.
Thank you, Fred. We have a very, very special award today. On behalf of the Board of Directors, we would like to make a very special recognition to someone who is very near and dear to all of our hearts. Luz Corquera is our program director, and this is a surprise, you know. Very seldom do we get to surprise her, but she has helped Healthy Start for 10 years with dedication and commitment for our moms and babies. Luz began her association with the Healthy Start Coalition. Luz, come on up while we talk about you, and then you can get really embarrassed. So that you don't talk about me outside of the As you know, we all know and love Luz. What can I say? Luz began her association with the Healthy Start Coalition of Manatee County when she was recruited in 2001. I think I was just born about that time, but as a part-time independent contractor to implement a small grant from the March of Dimes to conduct face-to-face outreach with the Hispanic Latino population to increase access to maternal and child health services.
Her individual outreach proved to be so successful that Healthy Start Coalition hired Luz to a brand new full-time position in the year 2002 to multiply her efforts through grant writing.
Luz recruited women from the Latino neighborhoods and trained them to become community health workers, who in turn conducted outreach to provide health education and support services under her guidance.
Luz recruited these women, and her efforts multiplied indeed. In fact, over the past 10 years, more than $500,000 of new resources have been generated through grants and private contributions, which have benefited thousands of moms and babies right here in Manatee County.
Luz's influence goes beyond Manatee County to the entire state of Florida, where her successful community health worker program has become a model to replicate, even extending to other parts of the U.S., gaining national recognition through the Center of Sustainable Health Outreach, sponsored by the University of Southern Mississippi.
So please join us in congratulating Luz for 10 years of sustained excellence in bringing about a vital link between communities and the at-risk, underserved population and healthcare providers, because all babies deserve a healthy start.
Well, thank you so much. This is really a surprise. You're not supposed to do that. I am the one who hands the awards. This is a very unusual spot to be. But like Martha and Ellen said, it is a privilege to work for Healthy Start, to work with moms and babies. I love my job. There is not one day that I wake up and I smile. I thank God for everything that I have in my life, but most especially for the people that I like working with, the people that I like working for, our wonderful community partners, and the wonderful people that support us every single day. When we look around the room, we see these beautiful women and men who are here today because they care. They care about our future, and they know very well that we need to raise healthy babies to have a healthier life and a healthier community. And we will be even more pleased when these babies continue to grow and we see that they are the leaders of tomorrow and they take this great America to the next level. Thank you so much.
We're almost done, but I want to recognize some more people. Everyone stand up and stretch. I want to recognize everybody that's here that's a member of the Healthy Start Coalition, because we couldn't do what we're trying to do and are accomplishing without everyone in this room. So everyone congratulate each other.
Again, thank you all for your support, your continued to support us throughout the year and make sure that our mission is met. At this time, I'd like to adjourn our meeting. Thank you. Have a wonderful, wonderful day, and we'll see you next year, if not sooner.